Melanoma is the deadliest form of skin cancer. The main cause of melanoma is from UV rays or artificial sources like tanning beds. Melanoma is a disease of pigment cell or melanocytes, which are cells that produce pigment or color of skin, hair, and eyes.
Melanoma can occur in one's eyes, digestive tract, lymph nodes, or on the surface of the skin. The good thing about melanoma is that it grows slowly and rarely spreads to other parts of the body and is almost always treatable.
Risk factors of melanoma include dysplastic nevi, moles that change and become cancerous, having more than 50 moles, fair skin that gets easily burned or red from the sun, lighter skinned people are more at risk, family history of skin cancer, people with a weakened immune system, and too much UV rays or people who spend an increased time in the sun.
The symptoms of melanoma include the ABCDEs, which are change of the size of the mole, usually increases, coloration is uneven or the color of the mole has changed, there is not a definite border of the mole or discoloration of the skin. If the mole was to be cut in half, the sides would not match each other. Finally, if the dysplastic nevi is changed or has become abnormal.
Doctors generally encourage patients to self-examine themselves to try and detect this disease early. Symptoms can easily be shown under nails, on one's palm, on soles of hands and feet, or on one's scalp. Another symptom is a brown or black streak in the nail of the thumb or big toe. Finally, the ABCDEs are used to detect melanoma.
There are simple treatments for melanoma if the disease is caught early enough. Surgery is used to shrink the size of melanoma if the disease has spread to other organs. Chemotherapy can also be used to treat melanoma that has returned or spread to other areas of the body. Medications such as interferon or interleukin are used to boost the immune system to fight the cancer and may be useful in addition to chemotherapy and surgery. This form of treatment is called immunotherapy. Finally, radiation treatments can be used to relieve pain or discomfort that is caused by the cancer that has spread. The survival rate for melanoma is very high. For Caucasians, the chance of survival after 5 years is 90%. For African Americans, there's a 70% survival rate after 5 years. Overall, there's a 90% survival rate in America after 5 years.
Some interesting facts about melanoma include melanoma is the 6th most common cancer in the United States. For women 25 to 29, melanoma is the primary cause of cancer death, and in women 30 to 34, it is the 2nd most common cause of cancer death. Melanoma cases are increasing at an epidemic rate of 3% a year.